Good evening, everyone. Thank you for joining us for this very special Bloomfield Public Library presentation. We are very lucky to have Dr. Bennett Galperin here, and I'm going to talk to you a little about him before he presents. Dr. Galperin is a graduate of Boston University School of Dental Medicine, where he earned his Doctor of Dental Medicine, DMD, and graduated magna cum laude in 2018. Dr. Galperin went on to further his education, completing his residency in orthodontics and a Master of Science in Dentistry, MSD, at Jacksonville University in 2020. Dr. Galperin is a board certified by the American Board of Orthodontists and is a member of the American Association of Orthodontics. Dr. Galperin is also a member of the Connecticut State Dental Association, Harford County Dental Society, and affiliate member of the Middlesex County Dental Society. Dr. Galperin grew up in East Brunswick, New Jersey, but now calls West Hartford home. After completing his orthodontic residency, he moved to Connecticut and practiced in Western Massachusetts. Dr. Galperin soon met his now wife, Mallory, who grew up in West Hartford. They decided to settle in West Hartford and live with their son and dog, just a few blocks from where Mallory grew up. Dr. Galperin, thank you very much for taking your time and your talent and volunteering to come and speak with us tonight. We look forward to your talk.
Thank you, Miss Mara. So today I'm going to be talking about when and why your child should see an orthodontist. Just backtracking a little bit, historically, dentists would usually refer patients to the orthodontist once all their grown-up teeth in, but current recommendations differ from that, and you'll see during this presentation why. So the American Association of Orthodontics recommends that children get their first orthodontic checkup with an orthodontist, either at the first recognition of an orthodontic problem or at age 7. So why age 7? So we're starting to get adult teeth at age 7. We start with our adult first molars usually are in by this age. And in many kids, their adult incisors or front teeth are in at this age. So these are some of the problems, just an overview that we're looking for. So we're looking for anterior crossbites. That means when the top front teeth are behind the bottom front teeth. Posterior crossbite, when the back teeth on top are inside relative to the bottom. Crowding, especially severe crowding. Open bite, where the front teeth do not overlap at all. Protrusion, where the top teeth are very far sticking forward relative to the bottom teeth. Ectopic eruption or impaction, where teeth are not growing in the way they are supposed to. A complete class 3, you might know this as an underbite. Diastema or significant spacing. And oral habits, for example, thumb sucking, finger sucking, or tongue sucking. So usually when we're seeing kids this young, under the age of 11, it's focused on concerns that are better treated at this time, which could prevent future problems, reduce the complexity or invasiveness of future treatments. So I'll start off with an example of anterior crossbite. Once again, this is where the top teeth in the front are behind those bottom front teeth. So this child was treated with limited braces, and in just 12 months, you can see how much his bite has improved and smile has improved. So zooming back, why do we want to fix crossbites? Crossbites untreated can lead to gum recession, excessive wear of teeth, and in some cases, loosening of teeth. So here's another example here of a crossbite. You can see this child has some gum recession associated with it. Her top front tooth, it's just a single tooth crossbite. Her top front tooth is behind the bottom front tooth. And so she was treated with a short round of braces, and in less than a year, you can see how much that recession has improved. There's still some recession noted. And another thing to notice is that this crossbite did cause some wear to her upper front tooth. You can see how much shorter that tooth is than the one next to it. So if this would have been caught even earlier, we could have prevented some of that wear possibly. And so here you can see, just by fixing her crossbite, how much that gum recession improved. And these are adult teeth, so this has got to last this child the rest of her life, so we definitely want to correct this. So here's another example of underbite. This is an underbite that is a class 3 type of underbite where there is underdevelopment of the top jaw. So this is what we call a skeletal crossbite. This child's grown as much as her lower jaw. Is my mic still working? All right.
Yeah, we can hear you.
Working. Um, so this child has an underbite, um, like I said, due to underdevelopment of her upper jaw. So this was treated. We're able to treat this with a reverse headgear. This is only worn at home, and it helps encourage more growth of the top jaw. So it's attached to a custom appliance that's attached to this child's top teeth, and there are elastic bands that are attached to the headgear, and this helps encourage more growth of the upper jaw. If we didn't catch this child would likely need jaw surgery. So catching at this early age reduce that likelihood that she would future need jaw surgery in the future. And you can see how much her bite is improving by encouraging her upper jaw. Unfortunately, this type of treatment needs to be done at timing is very important for this type of treatment, and usually it's best done at age 7. These kind of jaw growth that remains is very limited. So here's an example of a crossbite, a posterior crossbite, where the top teeth are in relative to the bottom teeth. You can note that there is a big discrepancy between the upper midline or the center of the top jaw and the center of the bottom jaw with the teeth. And you can also see his chin is kind of shifted. So this was treated with what we call a palate expander. You may have heard of these. These help widen the upper jaw, which is possible in young children because the upper jaw is made of two bones that can easily be separated with the palate expander to widen. So here's a quick video on how palate expander works. When children get palate expanders, we have the parents turn them at home with a provided key because this needs to be usually done daily. So you can see here it's pretty simple. The key is inserted in the palate expander in the hole, and then a turn is made until it will not allow further turning until it stops, and then the key is gently wiggled out, making sure not to undo the turn. So you can see with just a year of treatment with that palate expander, and we also did some limited upper braces, his upper and lower midlines are much more close to being matched. They're not perfect, but they're much more improved than where they started. And you can see his chin is better centered as well. So another area of concern at this age is habits, or most commonly thumb sucking, finger sucking, or tongue sucking. So the first line treatment that we often recommend is a bitter nail polish like Mavala that parents can apply to their child's nails. If that doesn't work, then we have other options such as a tongue crib that you can see here. It attaches to the child's teeth, and we glue this in at the office, and it basically prevents the child from sucking their thumb or their tongue. So this is an example of a patient who sucked their tongue, a little bit older child, but teenager. And with just 2 months with the tongue crib, you can see how much her bite has improved. She had that open bite that I mentioned before, where the top teeth were not overlapping the bottom teeth at all, and there was upper and lower spacing. The spacing is improved, and the overbite or open bite is improved. And now this can very simply be treated with braces or aligners like Invisalign. So another thing that we do when we see children for consultations is we take x-rays so that we can make sure that there are no extra teeth or altered tooth development, make sure that teeth are growing in the right direction, make sure that teeth are not impacted or that they're going to grow in on their own without any additional help. And also we're checking for pathology. So this is an example of an extra tooth growing, specifically called a mesiodend that grows in the middle of the top teeth. And reasons that we want to address this is because it can push on the roots of the other teeth, cause damage to the roots of the teeth, cause shifting of the teeth, or in some cases even migrate to other places in the jaws or craniofacial structures. So in this case, we referred this patient for that to be removed by the oral surgeon. Here you can see an example of a tooth that's kind of growing off track. It's pointing in the wrong direction. It should be pointing straight down like the teeth on the other side here. And it's getting in the way of this other tooth that needs to grow in. So by simply removing that baby tooth that corresponds with that grown-up tooth, in just 6 months, it started to head in the right direction. And then this tooth will have a better chance of growing in on its own, along with the canine tooth next to it. So here's another example of where teeth are not growing in like they should. This child, her central incisors have not grown in yet. She has this one baby tooth that should have been lost a while ago that's still there, and the other central incisor is growing very slowly compared to her dental development as a whole. So you can see here that one of the teeth is growing sideways. So so that tooth would not become erupting on its own without any help. So here we simply used a palate expander. If you remember, I mentioned that the upper jaw is comprised of 2 bones at this age, and by using the palate expander to widen the upper jaw and kind of stimulate the area where that tooth is, it started to erupt on its own, and then we were able to line it up with braces. As you can see, it came in very rotated, but still very manageable for us. And in just 18 months, her teeth came in straight. It took a little bit longer than some of the other cases we saw here, just because it took a while for that tooth to start growing in once we gave it some encouragement with the palate expander. And now you can see it went from sideways to straight. So another area of concern in this age group is space maintenance. So one of the jobs that baby teeth provide is they hold the space for the grown-up teeth growing underneath them. In many cases where baby teeth are lost early, whether it be for cavities or trauma or kids being kids, there can be space loss for the grown-up teeth that those baby teeth were holding space for. So as orthodontists, we are able to provide space maintainers. Like you can see, here's an example of one we would use on the top teeth and one we would use on the bottom teeth. These also are often done by pediatric dentists and some family dentists as well, but orthodontists are capable of this too. So another topic is crowding. So there's a bunch of different ways that we handle crowding, especially in early interventions. Depends on the situation, but one of the ways that we can is by selective removal of baby teeth. So because certain grown-up teeth are bigger than the baby teeth underneath them, by selectively removing the grown-up teeth and preserving the space with space maintainers, like I just mentioned, we can allow for we can resolve crowding without the need for removal of adult teeth. So you can see this example here. We remove some baby teeth selectively, preserve the space with a lower space maintainer, and then we're able to basically have a very crowding to so we went from pretty severe crowding to a nicely aligned arch with all of the grown-up teeth minus the wisdom teeth present. So I'll just finish up with a quick video about how to take care of braces, since that's always important. So with braces, very important to brush very thoroughly. Braces basically provide a place for plaque to sit on your teeth, almost like a shelf. So when patients start with their orthodontic treatment with braces, we provide them a toothbrush, floss threaders, proxy brush, and a hygiene guide. So it's important, like I said, to brush around the brackets, making sure to get that area between the tooth and the gums and the braces and the gums. So we want to get the top of the braces, the bottom of the braces, the front of the braces, spending enough time in each area. So that area that we're brushing right here, that's the area between the bracket and the gums. Plaque very easily, gum inflammation or gingivitis. Spot where cavities form or even decalcification marks. You may have seen kids with some white marks on their teeth. That's often the result of poor brushing when they're in orthodontic treatment with braces. So we're getting all the sides here, all the nooks and crannies around the braces. And we want to get near the gum line, like I said, to prevent that gum inflammation. And you also want to make sure to get the other surfaces of the teeth, the biting surfaces, the chewing surfaces, and the inside or tongue side of the teeth as well. So moving on to flossing with braces. So flossing with braces is a little bit more complicated than without braces. We have to use a floss threader, as you can see here. So you simply insert the floss into the hoop on the floss threader, kind of like a needle and thread, and then use the floss threader to thread the floss between the wire and the teeth. And then you just hold one side of the floss and you're able to floss up and down between the teeth, making sure to contour the floss around the teeth and then pull the floss out, making sure not to pull on the wire. Proxy brushes, also known as Christmas tree brushes, can be useful with braces. They allow to clean in between the wire and the teeth, as you'll see here. They fit nicely in that area. So also go over how to use wax. So sometimes an area of the braces might be a little bit uncomfortable, especially while you're getting used to braces. So you can simply use some orthodontic wax that we would usually provide. You want to dry the area with some gauze or a tissue, and then use about a pea-size amount that you can roll up between your fingers and then place onto the area that's bothering you. And you definitely want to remove this before brushing and then replace as needed. So discomfort. So oftentimes there can be some soreness, especially when we're first getting used to braces or after an adjustment. We can usually address this with over-the-counter pain medicines like Motrin or Tylenol, whatever you would usually use for a headache. Saltwater rinses can also be helpful with just some inflammation. In some cases, or gel can be useful if you have some sores. Usually not necessary though. You definitely want to contact your orthodontic office to let them know if you have a broken bracket so that they can be prepared to fix it. And sometimes you can use wax to help secure that broken bracket if it's sliding around and becomes uncomfortable in between appointments. So to avoid broken brackets, you got to stick to the recommended foods. So usually we say nothing too sticky, nothing too crunchy, nothing too hard. You definitely got to avoid popcorn or sticky, very sticky candies like taffies, really hard foods like nuts or biting into hard candies. Also want to cut meat off the bone and cut up fruits like apples. You don't want to bite into an apple or even a piece of corn with braces. So just reviewing those sorts of candies to avoid. All right. And that's all I have. So thank you all for attending.
Does anyone have any questions? I have a question. What age do you recommend that somebody brings their child in for their first appointment?
So usually age 7 is a good time to start seeing an orthodontist. It's usually most orthodontists do not charge for consultations. And in most cases, treatment is not recommended at that point. But we're there to check for these sorts of issues, to make sure they don't turn into bigger problems. And usually we would see children on a 6 to 9 or 6 to 12 month basis, from that point on, usually complimentary.
We have a question from Amanda. She wants to know, can you chew gum with braces?
Usually we wouldn't recommend it.
Okay. So just tell us where your office is located.
Yeah, so we're Conroy Orthodontics, soon to be Riverbend Orthodontics, starting in May, and we're located in Wethersfield and Middletown.
Great. And if anybody has any questions, can they reach out to the office?
Yeah,
Is
you
that
can
the
definitely
best
give us
way
a
to
call at our
contact
office.
you?
You can see our number there, 860-529-7200.
Great. Okay, everyone. Thank you for joining us very much. And we got some great information. Thank you again, Dr. Galperin.
Thank you.